Coronata. Amikin Coro, Amun Jankar Jawul. Ulala Nabay. Coronata. Ole minti coronavirus. Ikonya. Coronata. Ole minti coronavirus. Jankar Jaw. Coronata. Ole minti coronavirus. Jankar Jawul. Coronata. Ole minti coronavirus. Alngabay. Yimang kitakan. Yimang kitarangot. Yimang kitarangot. Yimang kitalinti. Yimusasanti mungasang adamati ngolla. Yimusasanti mungasang adamati ngolla. Coronata, ole minti coronavirus. Ikonya, coronata, ole minti coronavirus. Ikonya di coronata, ole minti coronavirus. Alngabay, coronata. Ole minti coronavirus. Jankar Jawola, Sasa Besiari, Saya Besiari, Chocho Besiari, Mol Besiari. Woto Walngasi, Suokono, Nihari Tenye, Bantoto. Alingan Jamura, Nimbeta, Bantoto. Alingan Bulokun, Safuna, Diola. Nite yake samba nimpate yake lamin nimpate yake corona me bandale nite yake samba nimpate yake fatu ni lami yake corona me bandale corona cha ole minti corona virus Jankar Jawola corona cha ole minti corona virus ikonya di corona cha ole minti corona virus alngabay corona cha ole minti coronavirus. Jankar Jawola.
Okay, fellow Gambians and everyone that is watching or listening to this very program that is on coronavirus disease under the Coronata series. Today we are going to discuss episode 2 in Aku Manjago and Karoninka. However, today's presentation is going to take a bit of a difference in the sense that we in the Gambia, the medical fraternity in the Gambia and the medical fraternity in Sierra Leone had lost one of the greatest mentors that we can have in the field of medicine, notably to the Gambia and obviously to Sierra Leone. Dr. Ulric Jones unfortunately passed on to glory on the 9th of September 2020. And we want to take the first half of this in memoriam to Dr. Ulric Jones. In memory of Dr. Ulric Oduma Emmanuel Jones, who was the first consultant neurosurgeon in the Gambia, born obviously in Freetown, Sierra Leone, who obviously passed away at the age of 79 back in Freetown, Sierra Leone. And I like to say that Dr. Jones was born in Sierra Leone for the Gambia. If you know Dr. Ulric Jones, you know he's a great and very, very skillful surgeon. I've had the chance to operate with him. I obviously hadn't had many cases with him when it comes to neurosurgery. By the time I came, he was no longer in public practice. However, if you work with Dr. Jones, you come to realize he was such a very, very, very skillful surgeon. He was such an awesome mentor. Dr. Jones has so many characteristics. There are so many characters in him that are worth emulation. Even at his, retirement from the public sector, he had worked a lot in the private. And in Medicare, I was his assistant as the medical director, and working with him was indeed amazing. Um, of course, he's also a great leader, as many as would know him. And he's got a great and amazing sense of humor. I think one of the things we would remember Dr. Jones, aside from his mentorship, aside from his professionalism, aside from his leadership, is the fact that Dr. Jones had a great sense of humor. And you just cannot be by him and feel depressed. And today, the Gambia neurosurgery is obviously less by one. The Gambia general surgery, I would say, is less by one. Orthopedic surgery is also less by one, and so on and so forth. He's done quite a lot. The news of his demise came to us with shock, a whole lot of dismay. But we do know and having believed that he is basking, obviously, with the Lord in glory, where we all intend to join him. Just some few things for the general public to know. There is already a website where individuals are kindly asked to go and give or write a few statements, their memories about him. It's in the Forever Mist, and the website is what is written over there below. So this memorial website, that said, is created in memory of our beloved one, consultant neurosurgeon Dr. Ulric Oduma Emmanuel Jones, 79 years old, who was born in December 1940 in Freetown and passed on to glory on September 2020. They would love to remember him. He would be forever missed. And on this note, I just thought it fitting to have just one person, and I am sure that there will be some memorial services that are organized. But since this is already an ongoing program that is dedicated to coronavirus, I just thought it wise to have Dr. Azade, Dr. Hassan Azade. Dr. Hassan Azade is a senior consultant obstetrician and gynecologist. He's also a lecturer at the University of the Gambia. He lectures both at the University of the Gambia and the American University. He's the head of department of obstetrics and gynecology of Medicare Clinic. And at the same time, he's the clinical director of Medicare Clinic. And he's been with Dr. Jones for quite a while. And I just thought it fitting before we start this whole discussion today to have Dr. Azade to just say some few words to his colleague or his late colleague, Dr. Ulric Jones. Dr. Azade, thank you.
Thank you very much. Good evening, Dr. Jabang, and good evening to your guest. And I would be very delighted. Obviously, it's a very sad occasion to talk about Dr. Ulric Jones. But by all means, I think I'm one of the oldest colleague and friend of Ulric Jones. The time we were working at that time at the Royal Victoria Hospital, he was the head of the surgical department and I was the head of the YNG department. So we've been not just colleagues, and we've been friends for many years. And I have learned a lot from him. He was not just a general surgeon. He did a lot of orthopedy. He did a lot of the brain surgery, and actually he could operate on most of the organs in the human body. And he did a lot of saved a lot of lives and during the time. And he was very humorful, and he was very out to earth. And we had a very good relationship there. And he put himself with all his operations and with all the treatment given to he really is in the life, in the heart of the Gambian nation. He loved Gambia, and he, although he's from Sierra Leone, but then we cannot forget Ulric Jones, just an ordinary doctor. He was a hero, and all what I can say, honestly, what you mentioned yesterday, we have a blood in our heart to lose someone as a great man as Ulric Jones, and it has been. He will be always in our prayer. He will be always in our heart, and then I really appreciate Dr. Jabang for your initiative to really remember someone like him, and then let us, his colleague, his friends, and they talk about him, and all what we can see about him is only can be appreciating his presence in the Gambia, and we loved him, and we still love him, and God bless him, and hope will rest in peace, and honestly, I'm just about to get my emotions back, because even last night I could not the whole night sleep, because we were very close friends, very worked together, and many operations we have done together. And when he came to Medicare, obviously Medicare, he was the foundation of Medicare, and he was the main funder of Medicare. The clinic we are having at Medicare, as we call it, and our bill of Medicare, it was his achievement to start with. The first stone has been set for the Medicare, and we are thankful to him, and he will be always in our memories. Every day we walk into the Medicare and out, and we will never forget him.
Thank you so much, Doctor. Thank you so much, Dr. Azade. Like you said, it's a bleed in our hearts. If you know Dr. Ulric Jones, you know he's so dear to our hearts. He's dear to everybody's heart. And once he's walking, he takes everybody into account. And there's so many good qualities that we can learn from Dr. Ulric Jones. And I just hope that, and I look forward to, like having discussed with you earlier on today, look forward to having a kind of, we are waiting to know what the proceedings are going to be from the family, obviously, in Sierra Leone. However, we do know that obviously in COVID, things are very difficult to do. However, whatsoever is going to happen, we would take it also upon ourselves, obviously in consultation with the senior colleagues, in consultation with the Gambia Medical and Dental Council, the Gambia Medical Association, GAD, and every other person that is implicated, to see the possibility of having a virtual memorial service where we will have more talks from the likes of Dr. Azade and other people that have also worked with Dr. Jones. I just want to say that obviously to the family, our deepest condolence from the Gambia. And I do know how the proprietor of Medicare, Madam Shadia Shalop, how much this loss has been to her and to all of us, both in Medicare, in Edward Francis Small Teaching Hospital, and in the whole country as a whole. And we want to tell the family that our deepest condolence, and that, of course, their father has been a mentor to all of us. He has been a great surgeon to our nation. And like I like to say for Dr. Jones, my statement is born in Sierra Leone for the Gambia, because he's done quite so much for the Gambia. And in this regard, I would just want us to observe a minute silence in his honor, and continue with the program. And Dr. Azade, thank you so much for having you here, and thank you so much for all the words that you've said. And I know it's difficult to say, especially when you lose a very loved and a dear one. So, ladies and gentlemen, kindly let us just take a minute silence. May his soul rest in perfect peace.
Amen.
Okay. So we would continue with our program. Okay, so we're going to continue with our program. Again, so today it's Friday, 11th of September 2020. Today we're going to continue with Coronata series, and today we'll have the episode 2 that is going to come on. Episode 2 obviously is the face mask. We're going to talk today about the face mask, and it's going to be in Aku, it's going to be in Manjago, it's going to be in Karoninka. The order may not be exactly the same, but these are the languages that we're expecting to wear. Also, we want to tell every other person as you watch these pictures, these are not the good ways of putting on face masks. We see people putting on face masks really in different ways, and these are wrong ways of putting on face masks. And the best way of putting on face masks is what we are seeing now, and the presenters will do justice to this discussion as they will go through showing us in all this. I am John N. Jabang, and I am the host and moderator of this program. And we will have Dr. Kelvin Thomas, who is currently in a medical officer in Buyam General Hospital. And obviously, we'll try to get in touch with him, but Buyam is far, and these days it's been raining. So we will understand if he's got some connection problems, and that would mean that somebody's going to step in for him. Dr. Domingo Gomez, he's the one that's going to do the Manjago presentation. Dr. Domingo Gomez is our good colleague, and we've not seen ourselves for ages, Dr. Gomez, and I'm happy to really have you on this platform. He's a senior registrar currently at AIC Kijabi Mission Hospital, all the way in Kenya. Dr. Gomez, you need to prove to me that the connection in Kenya is better than the one we have in the Gambia. And if you prove that to me, I will report you to your uncle. So you know what I'm talking about. So Gambia connection is always better, right? Yeah, the next is James. So James is actually a brother of mine. He's going to do the Karoninka presentation. He's a certified critical care nurse. I'm sorry, critical registered nurse. Sorry for that. He's also a certified neuroscience registered nurse and also a stroke certified registered nurse, all the way in California in the US. So again, as we tell everybody, we are connected through Zoom, and this is the number that you were seeing. And currently we are live both on YouTube, and we are also live on Facebook. So just a second. I'm sure I'm going to change this thing. So Domingo, I think I will have to get you on. We may be having some small issues with Aku and Karoninka. They need to work themselves out. The last time, guess what? It was the Manjagos that had the problem. But this time around, the Manjagos are here and the rest are having some issues. So we wouldn't know. So I will get it all the way to you, Dr. Domingo, and you really have the floor to present this in Manjago.
Hi, John. Sorry, I probably didn't hear the very last few words. Just when you said the Manjagos are the ones not having a problem this time was when I had a problem. Looked like it's
yes.
something.
Yeah, sure. That was the most important thing for you to know. We hope that the Karoninkas and the Akus will sort their problems out. Right. Yeah. So felicitation all the Manjagos in the house.
Thank you.
There you go.
Am I on video? You seeing me? Sorry.
Okay, so there you go. So the rest of us will go mute off, and then we will get that.
Molin boss ba yetin jibling Manjako. Ya karanya antin chiti molin boss ti katimu nakasantio. Ngal ba yetin jibikin nek nda chiti Manjako nda temul. Molendo Tumbos Ntari. Acha yetende ni kanjake Domingo Gomez, and wol in the Mbosa Kenya. And the wol Mbos Banyamba Chika Gambia bling na ngal bikin meki na chitri Gambia. Kachi binja bank ngalum tetaman chitamanjako amtemul mena molum bosut. Amka chintu ni me tetamanjako ampuri pinyaka nanul yakanul molum bos. Uchinda ronchi ka fet nyaka tinglergi de kom banya yirna po moje pe mepi po je mundo bling pi kanjaka pi corona bababu kalkuli timi te corona na covid-19 pinja pe petam fiar nja banjako kachi corona uchinda fetut page Facebook na YouTube rite weekend am parong ma fiar ram banyan don ka nyaka achi yetu njabut na lon nyaka nani njawti ndop moje pi nyaka nani njabi panam bija ntare unyaka njari po moje pi kachi unyaka undo face mask chung bura mi ndawi mi banyanku bura ri di yis na namtum abura mata be abaka na famak ka lamp bul anjaki nyaka nango lamp bul na be banyanka ko tima bul ba jatengler nge moj nko ti badokta me moj bling tu amanka sifa mul bling tu banyam puri po famul bu tongol ting sifa ngata nchiwi moj mi me kabut na mi me kabut banyam moj mi me kabut banyam inyano rol poko kapu apuri prukare inyano par mandon duk pur on tabal windon ko mabara wala peut-être windon ko mabara aka bak jeji pultul am dot boara mabara bo rosto yisu wala mtumu ngal plong wala bisu tiblong apuri po botte po penir on tabal windon nan doni kapula ruko pultul po botu ko kapula legi ngodi moto be babu ko jamu infectious disease wala be jamu communicable aci kom nyanka butanya chum moji muntamindu mankanja pumoy pi nyaka na ping pe mepi ka je ko mundo am fiarne tinja chete bling tu karanyam teka tim pumoy pumuntapi ko ci pumoy pam bof pe moji mi kam botu mok ama kabut moji mi meme ko jaka non infectious wala non communicable diseases chum moji mem ko jatam bot jatam pembul jatam tefna nyam botul wala yu nyanka ka gujori ka botul chum moji mi ka jaka mi non communicable am moji muntamu sifamul chum moji man na mi comme diabetes moji sukur wala moji penyak ko bi jawi tension moji presso moji mutam butum ko ci ma jatum but ma nyaka njantari ka remb nari moji mi kam butumi tati mol butum nyaka njaka remb nari corona mi mebul chunka no ramba nyati ngler ni bling tu atati umanto but ka ko nyaka njaka remb nari mum di njak roru njaka jemalir ret corona ri but nya ma nga jekk ba nyam bling ru chak wala ba nyam bi mem bof kata ret moji mutami butu kal anci bura mtum na bis bi kan jaka bi face mask ruko ka umbori rol di America long mtachi ngumbori ngu chumal face mask rumentari legi pomoji mutapi kan nanjake bi paje ko butu nyanka ja pomoji corona chung ci bugaw yafant bi kan jaka bi respiratory system chung bugaw yafant bi mebi uchinja teftu kot lola njawa kandana ma ayishalaru wala nchika yafantaro mak wala ngal dindi nyaka mbinku ci nyando tefte na wakani ma nyaka ndarul mak nguko ties ngi mengo jongu to moj mutan ka nyaka ngi bacteria wala viruses jongu to moj mutan ti moj nyaka nyaka na mbika ci moj virus ko ko repo pandim tumji wala rebis nji bu pandi mo baro rostu ba awach ko ka bandri di isu diko di ñana mëntu ni mepp ko mo waral butol dik butol wala kawum banyang ka puje malir ko nek jangal ka ñakan akabik robi tete moji mënta mum kandu na jakine bala man ñakan affaire fils ma kan jakine ci ngal koy mebam puri pour rowol territu yafantu bandri cintu ngal na dokta jakatu ko mene ko mënta ngo puri putanku rit moji mënta ko mbutre cintu chung comme ngal te bulom ki yafan sam puri puje ka ñanu tika joju metu ka joju tik kuturu yisu ki yishalara boru mantaw ay yishal ko mi shalon ku kari kanyanu te ben to dito bot banya ma kon pepo ko mburi chung koy banya ka jawin ko ciwi para proteger benum para tema ko me ko ka yo kam pomoji pumunta po wala ko kan tu pomoji pumunta po bandiw so como to ka jaka chung ulemp face mask ko che personal protective equipment be banya tema bi face mask chung pijam tu mjeju lam turi tema bura pumunta bon di yiso na mtumu uwaga kukuriri chinda chika wing ti umetari bi yisiti o mo bandri bu jogo kat pijam tema wol para banyak balaw ndika kurung man chika organize program ter on pi banyi foto e foto mo to pi bam banyanje bu tema wol balo banyanje bu tema wol utanyiri ite bi yisu kal ti ter bu jog wala bu tema wol bruka paful ti bu jog ti tany wala reka tutsa balo banyansa jak wimbu kal bu jejul bu tul ti bu jukuti ko le parata ko mo to ko ci ko mem ka tema wol ukulu bu yis nam tum bling tum ang face mask mu tan ko ka sifangul aka face mask kan jakari N95 chunga timdul chunga face mask ngi ngumantangi balem plok tanjom be plem nang ngumantangi mak anjare ka jonato dingul par ko chit ko ngi men ko jekku chaka bling tu hana nyambi ka wi par ringul nyaka nangul o kan ngi chinti ngi mebut balem plok tanjom be lemp nangul ma ngalu chim lemp dot tampar banyan wa wa ngul bling ngi chak mpuri pe temangul chungi cibut ngi me balem plok tanjom bu pep yu sir pu lemp nangul mak mangi ñeke pep ñaka nan tari chung ngi face mask ngi chungi menging nja banya balut jom lemp ngul citingi masin citingi ampning yu babu a cingi me balut kom lemp ngul ngalum kakal na lutri ka to mpuru lemp ngi mentang ngu ko kap janga ka ko bi layers ngu ko kap janga ka guburu ngi tabdal kap lemp na kase isende itabu mapuri pe jadar ko ma puri pe ka kui no kandi u pe ka na fa u chim lemp na ulu u lemp muntaw o chik lemp na u wachi wi tema u pe ka mburi ri ul par ko u tan kunu ya chi wi ni mew wi tema ul chi tu wi ni u tan ko mak ko chika tan ko chi ko mbim ji mun kanyan wa ki shalam ji ba metu ka joju ami shala rul ko ki shalon ko natna ti chitu ti witu un tu chirun ka tan ko par nyani u tan ki chu nyani mew no ndaw ka ndaw ul kongu pep ka mburi u chik tema wachu muntawi a wara lemp na ba chintu bikin meki bukal bikinda wakandar ko wala bukal bikinda bofo kata wala bukal bikinda chilu ko wala bukal bikinda chiko ndi bujuk de jaw kala ke jaba chintu ba tema wala par wim chir putan ko kala baka patan ko bot pour ba tema wala kuin karanya ka jana cho wala na yishal wala ngal ni yafuntu ko o kaya tu tande pu banya chi bigri peti ulong shaka chi repeti o kaya tu bot ulo ka kongu lemp ke jam karanya ka peka utis sa tis su ching mask ngi chimpurat peka mas mpuri sa ka kongu mas nga peng ta ngu ant nga ba kar sangu ko chingi mem puri pelet ngul kalong dinaw let nam pep wokan ko lemp na kalong ngul no lemp im kep lemp na nga kamang pep nga pero peka na faul bling tu we komba nyang kap lemp nang wachi achi ulolo uga tenku pur dit yang kap moje wala dit wala nyam pu moje par ba nyang kap me we mpurir pu Afrika to dit kap moje pu mantapi ma nyanan ni me apandika to ana chilu tande ne kay pu moje pu mantapi ak pani tiyupul dika to komba nyanja ko chitu ko nora pu dekalira nyaka bandi dekalira di cirika takalolong ak baka karonun de temanga mask ma o nyan chil ke chil ba otande mka pija ke temo mask montawe anda chiburi kata anda ko me umi tara we menda pour la wonder potis da pour nya nda tef de la wonder potis ngalu jeji ngi meter ngete de nya kana tun de telar muton ka pepeten ka ba nyam link mo monta pika ba wajan ton wol ko kala nya ka petemo face mask ya chipusinga ya parola pour peten kninja pour mo monta pika sharp bare u chak paru chip pachim ka banyan jemalirat igayi me ko tank na banyan pour moj pika ba moj pika contenar pepu jek na banyam bling poko pepu jot ri bataf ma poko puri mojo pat mobo pat ding book be jana pat nan ke ngwanu te be na root kompete mang mask mari Gambia ulua jana pat nan ke ngworo page pe root par banyam me blinga nora am pujeju mask ko na pat ni me ka ngwanu te banyam me ul bling tu ma ke jemali root na pat ni me ka ngwanu kanyang anere kaska te mangu u face mask kom be ulua Gambia jabang jemali ko kusuliyot uchilu tande par nulla puri po kapul rule akaba ne tisi no bo tampul na taf na ci kata ni me ka pu moji plon par bin jaban ko be jor re bataf ape but pu jor re bataf bi kim mek be pam moji mlon ko mo moji sukur na moji tension moji asthma moji bi cinci moji man ci bam ka bamul rek am ka rukusu u force u mew u lefu jo kamandaro par mu kam lom moji ka am kaba moji pe ka tem kaba muntamu po anora no mak teng mebling tu par balom banyan chit kwai chit manja ko tani bal chamba chuma la jabu kam moji sukuru wala moji tension brika chit ka tabrika me abu ko biya lop tan ko to lon ko buru lentu gal kom am dong kap moji tension wala kap moji sukuru ul ko jakat pija mtafrika takija andi kat moji bi karanya nga puri kap moji bi ko banyan kap je malere maka mo gor ka mo baratu rostu ko nora ma rostu ci wechu am pu tibulom puri biya ya ndara ke tew chom ason ko mo barawol balam do ka lesambaru jek na mo barawol kon ka nyaw yen ko force ngal mu ci ko tis amute lesambar ke nyaw nyam bala kro lo ko kak so ka nyaw nyang banyankat ko fin ko ngal ka kanga maskum utabantang wol banyanka pijam chilba amiyari rip di bujuk ti banyang tonka ndarte ba chum kles ne da kapjan de lang sarkotis nyam berat nya ma moji chipum pimme ko yepar banyam lang sarkotis purpul ko ba banya lang sarat ko moj prika ba ko kaja ba faisa pu wite ta puri pijam kapul ko je am yesatum puri pije ci da brom ka yelan kliya wach puri kapul ka ci jakam kapul yas lolo nek kapul ka o to citing banyang puri pijam chile am yay juki menk ba kayay jukti ben ko ki banyang ngalat ko ma yilongi juka ci mei song ke yel mkang ka koro manja ko jabi jamang kang pia am ya bayul ke jemalir ke jak nyaka na nya ke tema mas ak nyaka na nya lang sarkotis ak ndut ka wol dari nyaka weku de les ka nyawi nyang mak but par ko mo ton ka tink banya mak ti ka rukus ko moji ko montapi man tema face mask rin do wi bi man tema ri me ko chiri di ngiri bi ra jaru kul bis mentumbling da we ner ko kulim ko pendi bis ti ter de bu jokti da face mask ka pije ko kul ko temaro la bala ko chilir gata ko temaro le ko menel ti recin du ko norana tu yafant du ko mingata mak te ko mak mene para mingu ka mak ko chilli ba nyanci da ka bak geblar na ba nyaaka bak ru les mbar ner ko ri ming mak ko yi nyano yiki je jon ko top bambus yo burul akaba met me nyano yo mem mobarank ba koy mem dot kap mobararo so kap jak ndo ka pendi ka to nyano ko jent ba ki ye ci sol ko maral lingra rultu mingu mak ma rultu ruyero bot ke jemalir par ndoba won ka tanku borom dit mobaro rostu kakti uler wim ci lu blinga ka kama kuite ki nyawnya bala ko jeni nyano ko patch face mask mantru akaba ko contenar no le no lempo ma fiar prim pam pinkare ndo man tanti akaba ka yepar ndu ci banyanka ngi yepar wala cete por pe jambel de ngi yepar ndo blinga tu wala ngal mkatu yeparam ka koy mewlim ngalom puata sri ko njawang unda cete ondi ja anda por puata sul da baramak wala no mboska.
Okay, Baran Domingo, Dr. Domingo. Good. Are you getting me, D? we had some few time to time we get frozen and then you come on board. Can you get me now? Domingo Mtena.
Yeah, Manteo Legi, wow.
Wow, baran. Covid nga achi important because mask achi important, the coronavirus. Like you said, everybody should put on the mask. If you leave your house, mponi riba kato mask. Like Domingo demonstrated, I think. Kombi Domingo Pipanwing. Thank you so much, Dr. Domingo, and I hope we will get some of the more other discussions hopefully later. And we would move on to Dr. Kelvin. Dr. Kelvin Thomas is obviously in Buyam, and to all the viewers, just want to say that like we know, it's been raining very heavily these days, and the connection has not been very smooth. But anyway, we are sailing on, and we want to just thank Dr. Domingo who just completed the Manjago presentation, and we will move on to Dr. Kelvin. So Dr. Kelvin, if we can hear you, that would be fine. Otherwise, we will have Dr. Margot to actually present for us in Aku. Kelvin, are you good? Okay, so we seem to be having some problems with Kelvin. Margot, we can go on with you if you are on.
Good evening, Dr. Jaban. Good evening, me company Dr. Dem Wedi Nayaso, and good evening, all man where they listen to me. Doctor, thank you back where you call me at this program, yeah, so for come keep comping with we fumble them. And thank you back where you remember the late Dr. Jones. I mean, true saying a very good doctor, don't I mean true saying a big man now we own society. We they pray say God go and cold ground, and then we left behind, God have to go cover them. Today we they keep comping, but we fumble them now about face mask. But before we start, we comping the company we they keep about face mask. I want to tell you now about two type of disease. Where then doctor then and then with man can call infectious and non-infectious disease. This type disease here, so the one we then call infectious disease, the bacterial, virus, parasite, and then fungus 19F for spread them. And this kind of disease, if you see them call it infectious, then call them so because able for move from person go to a neighbor, able for go from animal back to a neighbor. That now one they can call direct. You get other one back where they can call indirect. Where you say the person can get from in environment and from then thing where they in the environment. The non-infection back, now then kind of sickness where person can get, but the sickness no go to from to a neighbor. Like for example, diabetes, hypertension, cancer, and heart disease, they're all non-infectious. The infection one then a sickness like a malaria, where man can forget from mosquito bite. The other one, HIV, where man can forget between him and his partner, if they're sabi themselves, or between where man gets contact with blood sample where sabi say it contaminated. What to make we dey talk about this infectious disease here so? We dey talk about this infectious disease because COVID-19 na infectious disease where they affect the whole world as we do so. And it can for spread through what they can call respiratory secretion. This is another thing we can come out na person nose anymore if you cough, if you sneeze, or when you talk to person, especially if you be to say even the person not far. And then when we land on say if the person sneeze, that thing we can come on na your nose anymore, he able to travel to 1 meter apart, 1 meter away from outside the person day. Now it make it good for make we they use this face mask here so where I go talk more of later. It get what we can call mucosal surface, where you say another thing where they inside remote. So when person cough and you open your mouth, you forgo if you touch your mucosal surface and give you this infection here. As we do so, we not get no medicine for the COVID-19, we not get no vaccine back. So now we get for help ourselves. Now we get for protect ourselves. Within the English man can say, na prevention better pass cure. Wetin make we for prevent, wetin make we for help yourself, and how we for help yourself. Because if we help yourself, we dey part out this disease here, the sickness they go from one person to a neighbor. And we how we for part am now. If we sabi say we not feel well, make we keep to ourselves. Make we dey wash we hand, make we dey use face mask back, don't make we dey observe social distance. Wetin na this face mask wey we dey talk about? This face mask here na a type of personal protective equipment wey dem can call in short PPE. Wetin this face mask can do now when you wear am, it can part the if sickness dey around you atmosphere or environment, it go part how it go move from the environment come to you. And if the person back get the sickness, it go part how the thing go travel from the person, it go to the environment or it go to a neighbor. How we for wear this face mask? Where this program just start, Dr. Min don't show we the different type where we can see person and they wear face mask na tongue. But not also for wear them. If they do thing, it fine for make we do them the right way. And waiting at the right way. When we wear this face mask, if we cover the nose bone, if we cover the nose, if we cover the mouth, then if we come back na the chin. Now so we go for do them, when nothing no go come out from the person, go to a neighbor, and nothing back no go come out from the environment and come to the person. The thing back not for tight. You know, hello?
Yeah, your video, would it are you okay to put on your video
Sure.
so they can see you? And the connection is absolutely superb. I don't know if the video would affect it, but just come on video. And
Okay, hold on a minute, ba.
I'm gonna ask you to join video. Yeah.
Yeah, okay. Hold on a minute. Let me try and see. So I doubt if my network will be able to support the video.
Okay. All right. Okay, we can go on.
Okay, but I'll try. I'll try whilst I'm presenting. Anytime it comes on, then that will be fine.
Okay. So Amon, if you say anything, Asabi, I go put on my face mask. Let the people see him.
Okay.
Good.
Okay. If you put on your face mask, like I mean, say, if you cover your nose bone, if you cover your nose, if you cover your mouth, and if you can't turn your chin back, the thing not for tight, enough for big self too. If you just fit your face, and if you make sure say you're comfortable inside them, enough for irritate, think anything will go irritate your nose, if you avoid that thing there. Don't need good back self to make you know they touch your mask, they touch yourself. Because if you better say the mask don't get any virus, if you they touch the mask, they touch other side, the thing where they prevent self to no go effective again. You for pick up the virus through that thing where they do, where they touch the mask and then touch your face. We get different type of masks them. We get one where they can call medical mask. Then why are able to block a lot of things there, for make sure say boko things that know they come out from the atmosphere and can't we. But this way now mostly na hospital person then can use them. We all get other one where they can call respiratory face mask. Commonly, then why I can see on a tongue. You can see like an N95 and KN95. Then why are effective it for prevent about 95% of virus and them particles make the not can sickness make the not can to we. But the one way is say nine WHO recommend for them person. The one way is say nine then Dr. Nayaso back recommend for them person. Nine are the cloth mask. This wire so easy forget. It affordable. We all able to go to retailer nearby. Make it so on for we. If we get one or two, if this wire dirty, we'll for WhatsApp and end. We use the other one. So this wire very effective as per community level. What make we can say make we cover we face with mask. This skin, you don't the then one way land don't see say this thing here the help for make the disease part. If you use them, I can like I mean keep comparing what Una earlier, it can help for make the sickness not go come up from one person, it go to the next to a neighbor back. And who say we for wear mask? We for wear mask where within a public. We for wear mask where within a gathering, where we dey keep where we dey sorry say we dey rub skin. Where we dey away from we home and where you say we and the person then where we dey with, we not dey 6 feet apart or where you say at least 1 meter apart from that person day. That 10 day it good for make we wear face mask. And this mask where we dey talk about not just any kind cloth mask. It good for make it be at least 1 or 2 layer. So if you to say they take the material, you line in the material, like I wanna keep I then create talk, the material for lining. If now one lining it go get safe, it's not bad. So at least it will be 2 layer or 3 layer back upward. I may not tell una earlier say the mask for cover with nose, if for cover with mouth, if for cover with chin back. But if for take them, then one way land don't see say, then picking the way they 2 years and under, you not get need for make them wear this mask here. Because then picking the young chest they develop. We in a big one, we don't develop done. But then when we do they 2 years and under, the young chest still they develop. So we don't see say then when we they 2 year and under, you not fit for make them wear mask. And then individuals where you sabi say then get breathing difficulty, they're not able for breathe serious one, then self too, it enough fit for make them wear mask. Where make waiting na if you not wear mask, waiting you go for do to we waiting you go for do to we neighbor. Because now not about me, not about me neighbor, now about all man. If the person not wear mask, he able forget the sickness here. If the person back not wear mask and in get the sickness, he able for give neighbor back. And as we sabi usa we dey so, the government don't talk say we all for the fair face mask. And we all sabi say it good for the listen to what in the government talk. At least not that na a sign of good citizenship. So if you dey come out, make we make sure say we all wear safe mask, we all wear cloth mask. And apart from the cloth mask, what else we able for do? For wash we hand with soap and water for at least 20 minutes. If fine for make the water, make we open the pump, we use the soap, we wash so the water go dey run, not the water will go dey inside bowl. We sabi say if dirty dey in our hand, it go just sit down inside the bowl. But if fine for make we open the tap and use water, so this if something we hand me dirty, the dirty go run come out. A good back safe too, make we keep social distance. Now to time for our body, like as I mean tell una the last time we they keep company. Make all man day to himself by God empower this sickness here so go done very soon. And we all go able to go back to your normal activity them. Wear mask. Even if na material mask now they wear, no problem. If you say back you not get mask, if you do cough you mistakenly come out. Now for make sure so you cover your mouth with your hand or you use tissue or at least you bend your elbow, you cover your mouth where you dey cough or where you dey sneeze. And back, this stay away with it so think stronger. Now for avoid them crowded place, especially them place where we sabi say you know get plenty breeze and then person them boku dey back. And if you feel to say you yourself not well, make sure say you sit on na house, keep to yourself. If the need be, as I mean tell una earlier, una call 1025. Maybe later on I will get chance or my brother waiting there so when a Dr. Kelvin himself to go get chance for keep company with una. Dr. Jabang, thank you, thank you.
Thank you. Wonderful, wonderful. Fambul na don yari waiting Dr. Margot talk. You don't talk good one. Today na the mask. Now we responsibility for wear the mask everywhere we go. Everywhere we go carry the mask, and the mask is important. So thank you so much, Dr. Margot Green Harris. We will just take a small interlude before we will get James on board to give us the Karoninka version. Let's just have this small interlude. Yeah, there we go.
Coronata. Amigin toro, amun jankar jawol. Ulala na bay. Coronata. Wala minti coronavirus. Ikonya. Coronata. Wala minti coronavirus. Jankar jaw. Coronata. Wala minti coronavirus. Jankar jawol. Coronata. Wala minti coronavirus. Angabay, imang kitakan, imang kijarangot, imang kiserangot, imang kitalinti. Imusasanti, imungasang, adamadingol la. Coronata, Olementi, coronavirus. Jankar Jola, Nasa Besiari, Saya Besiari, Toto Besiari, Mol Besiari. Water Walgasi, Suokono, Nihari Tenye, Bantoto. Alinganda Murani Mbeta Bantoto. Alingambuloku Safuna Diola. Nite yake sambani mpate yake lamini mpate yake corona bebangale. Nite yake sambani mpate yake fatu ni lami yake corona bebangale. Corona time, wale miti coronavirus. Jankar Jola, corona time, wale miti coronavirus. Nikonyadi corona time, wale miti coronavirus. Alungabai, corona time.
All right. Alu pakanam kalonia fioi ko teke ukiyo kele katumbu ku coronavirus fioi utakata kulompo atuna James Jabang numeyoti Asan ngamiani Amerika nayem akna fa ki fioi katimbo ku kulompo ning anu wan fioi amana ku klonai di kuwe di coronavirus fioi ku berga ku toni ka katimbu ke soni ti waso wahe wa pakamang kasabwa mask Midman James atak-atak pume kaloni kasok mask bare mask la manchi mayo follow so James afwa ku fioi ku many creating mask so James you funny fioi ofani hilima
Apa siam
doing see
apa siam okay. All right, okay. John, are you catching? Abaraka fai in chupiam fale kati ukupa opo hinatra puru opo isana pakanona ning Gambia pulontu koning kagunyenga una pulontu le hale ti hisoko koning nukata nu yake apuro kagunyuka kati kemen inko fultuna yo janinchi yo nyum wa wonjile fe wa soko pamba ka puru pamba kapi me eknem koning ukunyu wa uyakae kukunyu we kae we ukunyu we menu ukunyu usubo yo tagada ukunyu we meni na e kawo hom ko kunyu ka identify wati ake an ubien maybe under liklake na awel luklompoto ye ko kunyu ka yo tagada ukunyu we meni lomponing ukunyu we meni na e kawo atino hikawvan ake kunyu eknan kasokondon infectious disease ekna meaning adino katifan yo kogunyu ka kenga finga katifan eknem samanin kogunyu ke meaning kakaiti enkan kasoka fusuba kogunyu ke meaning TB kunyu façon identifan yo corona yelompo yanga soke fie temeaning corona ye ekna yenye fuli China ne fuli ne to ne yenye ne han chalolo tudune plontu na fa namftu kunyo mani identify your an so kunyo we man natino katifan egnem ko kunyo ke mani ko kunyo kiti suklo ko kunyo ke mani hisimi hesilie kunyo façon atino ka katifan yo hewnu no yake isoko kunyo wa purpamba katika me pume kunyo nu katnole na kolu katu ke kunyo we man ninti fanwo ukina pamba kanga hanga fe hewunen kapfayo katu nawe na tambanu ha api un productive then afa jukone ano na ini na yakyo yo corona yelompo fiene kai pike multi home ko so kuna ne jukeni pamba kanga ti ko kupetio yo inflado ko woman nu la fi hisoku ko nu yake ko corona ye kadu corona ye takata ko kunyu kemen ki kyogin ki hiti kapi kemen kit sempe ki kakai ki papan pambaka plontu ki pahan dunia plontu ekonomia sanye ne date pekayu alun lompo ni twaju Gambia plon kadu Gambia tapale tako dule me aning wate me aning airport in close it babakan date ki pambakan date pahin you have meaning tianga ka afuto kapi meaning ku many in serious ku meaning ku ati cha handong achiwa so ko down in chukeni uni apokalu uni paka hopalu toko nu nyinu walu ngati ki puru sakalu koning I kokunyi me aning ki kiti kiti jahantom ko kunyi ke men kina in serious atuka so kuna nu yake ki koku yatio yo so ni ko kanji ko kwa kutom fio ki kakati ko kapi ke me aning ko kapi kiti eknan kaso ya mask eknem I just puasi pin simple very klonai maybe ni ya kuta ka charge wetio bare amunta ko I kilanya njafi pampangan ti pohongi peme aning afujuk ning ai ni na ki huma akem bai kum kai ka huma yo so woman fam fang nia so nula woman fam fang ananga hiya ku kapampangan kapi kwa wafu wasti pohongi so njipi sana lu woman nu yake sofie so nas fie angan jinsikange fie kineyam pui maske yanu sok ya wahu menu to kapampangan po mas papi kae pui façon jama yo takataken pamme apaning empanu himpati lockdown eknan kasok simple mask or medical mask eknan jinsike fie so eye yatoko and then also then ekayalompe eknen nu sok yo N95 ye ekne hange hinu for eknan jinsike lompo fie so jifi sokalu fam pikatnole na kolum yo so eye yatoko ning eye jinsie pite ye fie yo infla to kolompo eye nya sepin lompe ekna we ye fie ye ni sinyana fie ange epanka chope kapti fie yo nas na yasanao lipe daw men ka hitel ko fie atukam yo eke lompo ange lompo eke mask lompo pila lompo ka chope nkati lompo fie atuka yo so angem pi mask pape hina different eye ekna nu use ti ploptan pa fampang ke makaning anenge men ke ko kunyuka ke ko kunyuka kine hingarau engam meaning uni plopi hina loptan pa pikna nu waso puru tumpu inipo tumpu usika kunyuka lompol tumpu utifan ko ake lompo yo eknem masugune me ati kapi ke meaning paukaim di pahimpa piti loptan hanka soke pur dunia plontu kate ini hita aku eknem cloth mask eknem kupil mask meaning pilani ka job panka job kapchif eknan jinsike fie eknan uya ke fio kupu memak pur anowan katu lanu la fela pur ubuku yetio eke eye fie eye jinsike fie eye ati ni opinion yo ya na ya kut sepagat hi jumbet so na wase ayonolia nengela chata ati no hinyo fo awantio bare ye na wase ayo nenge la chata aini nyoyo i tio use kotake so na chief na ka maybe sus box hojil na wase ayonol eke ya nengela chata inchopi hinyo achuko okay so eknem mask pa fam pikatnolo fanna kolu now woman maske ni hin important maskela ni hin la important katu waranji yanyi ta koku hila mai tom soka so koni ukunyu tagada ukunyu fason usubo tagada ukunyu me ani kige ka ukunyu ka kigna ay ninti fan ko yo corona yekna to ko kunyu ke me ni ay ninti fan ko te an apiti fan ko take an so maskia eye to lane hinala kunu antimpa ini kadifane kinem koning na ke huma na ko winga menkin pumenki anke nkiti na ke huma ainin tifan ka hum ainin tifan ka huma intifan ko kunyu katan atwa yo hold on a minute. Okay, sorry. So kakehum na kehum no, I think hold on.
Because Ankai currently up on mute.
I think I got it. Okay. Okay. All right. Sorry, I technical difficulties there. But we now continue. So, John, apatisium tom?
Yeah, nobody's here.
Okay. Okay. All right. Good. So, lanci sakla kokunyu kiti kemaning ainin tifan ko kiknau nunga ko maskia. So maskia samani fanyi sokafie eknem ti pilanyi pa pembanyi singembe pegna pm epange yamini ainin chifio na chifayo ni kai nui tankan di pura kokunyu kan bi kitif atuwa. So maskia sanyi so kogunyu kan lanke man na ke huma because fan kitifa aini intifan ko ginin kitif na ke huma ning achisuma au apati koku ingin fon kitif yo womanu nu yake ihnu koku indulompo hiso konim pamba kati ka sudo kapi job kapi kova kapi pantan pohongi put bika indi katifan pagan woman da ke no ekna because ploptan pet Gambia pia kod forest yo fia ko kunyuka kit corona ke ka ti ko kunyuke menin kia kod vaccine kia kod lompo kio emianing like ko kunyen samani nu soga koning na ka malaria ay naka tloptan ngayin ka kunyan ka fan chloroquine ka fan lo eke pengu ne kunyan yo ko kunyu ka corona ka ko kunyu kemaning ko kunyeto etaki iyo so woman nu la fi so koning pamba kadin ka chop ku et mas kati kadin ka pengi kadin ka hin hongi katu egne fe ni kaun koning ko kunyu ka timpi kai timpi kitifane tan ngai ngipitif take purumpu punya ku katifan take iyo so kunano yake so konim pamba kadi kaini kaini hichopu kapandan pohongi kapinengeng ai kadin kapandan pohongi ajuka tulam jibisinjan just kadi kadi engenge. Okay, let's see. Yo so eke problema melompoti una lompo Gambia din di pakanuna alompo kinem ko kapi ke mening pagabga kele chingage so unga koning ko kunyenge ka kunyu ke mening kineta pagabanga so okay akena kakai pambagan katoko pau kachukot ananga ke ko kunyuka o ubien kaso ke o masukunda manila malamanka ke hinye sutu ku kunyenge kitaki bare kuyela nemla awet naka faso koning inchi kunyenge ye kitaka tako because ngini in sogyota we touch awetita atini atulong akati ni so koning awetaki ainan anjuka so kunana njuka ni man janin au fi no faso koning au chuko chukta maybe figeba tumando baru ignani hinle so kuna no yake so ko koning pambaka kati kainan koning ku emani enerati chahan injip lan jem la injipa ipe le boburin jempe tiko kapi kemen ko kapi kitloptan jendip ko pein ungkat ko kunyonom ko pakan kemen kai ka ko mupunyu ku emani enerati chahan ku emani etaki okay ke kuyella nem la lompo hewne nu la fi ko masukunde meni yet ko ku kapi ke meni kiti ku loptane ni jara ken yang kaim to eknem WHO kaso konin uhina use maskia eknem kapi ke meni etishnu kapandan sini ni ipohongi puram ni kativan hewne ga ke hinu katu ku meni mike mahma meni ko kunyi ke kilaki lako egnenga ke hinu kaina hinyo ning forase nka hinyo ning kem ning eti so ko ning pamba ka hinyo anu kainini kaina ine kana ngaini hinu stop spread eti ekna virus ye because nasin jana egna kuya ko kunyi ka pangufli ek nem China population eti efomafom hanga fala di kakai for from dale can hang pretty much dunia plon to pick up contest like hanging population but omen e could ko sempe katu bring ek na take kaso koni ano na waso mas kaso koni ano wan na noti sunu foni engenge yo in chuka fi nu wa ho men we in work like na what agna vujobi api in use to api no use for to be pura kadi ni hinu ko gunga timbiki ni hinu spread ngita mansere ngile fi ale case ne kinem samaning na wole fi kafi dan maybe pick hifulu like na apaka like na yo to put that on society suboxa se kaso kiem dogo yo now we pakai kaso ka ainin kak jora o ingani moto now ka ni nyota maybe muntu mem toko panga ka kan nyota muntu ko pam ku choki yo pakai baka ninka ka ni moto muntu ngeta choki so awe puma fi no awe o ma fu job now we me na ka to ko ni nyota muntu ngefe choki o na ka ni moto muntu ngeta choki moto afu job na le fi long so time man sere follow po maskene because maskene na wasiayo isen koning ko gunyu ko adini ko aini purapi ko in casino o adini ko katifan ake yo so kuna unen chukeni man winu emphasis nu yake pour pambaka di kai kwa sok mas na chuka yo to be move forward let's see here so the eke kuyenji le fi alompo hisoku ekne usokazo ku mask ya bare puma waso mask na normal katu pigepa ancho mask ya samani fanji siko fa fie inchopio ihinyo fie ti fie nakut na wasiayo enyanganyang ka pan panku sini fie samani fanji jota fa fie ne kite tam fie ti hisemfi so ti sini 40 semfi achuka na achuka yo fie yo na wasiayo fie infultigitan na fulatigitan ninjika inchok ake maybe in pakolning akinolam timpisayo epes una cambia usalasal ku pisayol sipes katu eknem culture tuna ning kakijan ning pulon du nyawanya bare na kaya na achuka omana timpokolo nsoko koni kare pumeyem kasuma lama niyama akolu ainum fano kachini achwa yo na ina mistake apisayo epes timpilik masketi fia because nalika na sayepes hinkata maybe na yaka na takaman in your FSC. The punyo palampo pignapium ananya patinyo FSC for about 15 to 20 seconds. I put to 50 about 15 minutes. Atinyo CPS proof a apunyo FSC for fair call ning servant. Yo. Ning ahina mistake lompo apina sepia na le fia say you na was amasia anyong tiluke pesifie because na li pesile le la chata la chat samaning inki na ke inki ngau chuno le fia akana inki hum o akana ke hum ga ni inki ni kadwa we mening o kresa agres ni tenicho ajuan neni ne ne kiti masker ni hin de noti putota e hatikin e tirang libe yenge na to ba na wasa take epesi ne la chat so na wasa ya fi mful chikitan na fulyo na kiyo tenu fumen fulanio nka anticipate nka wasfie pesifie puson mfulanio fie nka yenan so samaning e ete panye fie na kiyo anchopchobium inka na emayeti mateno flamum fulanio nka welio na welio kusiapa populum fie na was out of maybe 20 minutes 30 minutes to pisapa populum teyo wa hawem to fuket yo mfula to na ka susubo injob ya injob yo ne ye la chata injob yo nyoyo achuka yo for name the proper use of mask here let's see here. So eke kuya lompo enjile fa kahi soko koning lompo eha ku kem kati ko kapi masokunda eti jara Kenya kaka soko ek name social distancing. So social distancing nin kolona ek name midment if you not translate kadu here in Coronata from samani fanjope changfi memak sokundu my sokuning ikudu bowa yasan but egnem koning samaning out ananga meni anangam funut aknafi ni ati ni o hikolo fu na patekano compared to ananga meni afuno fu memak angam funa ya memak aknafi ni hikolo memak na funuto ati no funu so time as a social distancing so ning ananga meni pi our now patepaka you hin assume amunta not kunu we koning ano na kai ko kunyuwa so ni on ka kunyu ning kunu ngata kanu kuyata konu koni ano na kai ko kunyuwa then now kaya kolo na kaya afi had ufano meter yonol few meter yonol nanga pad meter yonol o uni pero ninka so 6 feet but lango dal na lango den afu ju koning hata ke hum pa huma pa pikayan to mbaka ka cha hingin bare pilangan to yon bare na kola omana mpi nim pekay omana mpi se hoto to mana yankenke ko hongyo de na ko kokun yo bananga langa den afu ko ning ekne fe omana te ni yoku kokun atiwa so kuna ndu WHO ko ekna masogunde yankasu ya WHO ene meaning ko knemti ko kapi ge meaning kiti kiti jara kenya kaso koning katika him enkenke kai pampaka kading timpingka timbika kolon atuka nupangera manyi na makile so okay it's okay so kuna nkaso konin pambaka timbinga kolo iyo eke yalompo enjile fi yalompo koku fiu kuyetu eknemti koku kemianing kapi kemianing samaning ay ku maskia kana nulla fi pupa non apie bana ko dio na le fi keke hum inchop epesi inke hum toko yama ay ku maskia bana ka maskia inke hum luko timbuflante masketi ko angam fan angam ponga ihne ti pohongi umfulanyo unso apike hani yama yatoko yenoto kon ke ninga aya ko maskia inke to because poko set maskia ne mpura gat ke to an bay ni ko kake okay ngipi sinchan I think probably yakayek probably finish with that okay. Okay. So I think kana meet how many minutes ngia bare iya maya ka time if ke kota ka puru kati hankan kana kige ko ka bare basically wa hawa nu yake soko pakanu na ni epo Gambia plondu konin kawa sopu mas yo hono le hanjile fie kafenan toko I know ta amedo mitfepa eknem pakam pakake kaning ya puge kema kaning pako pufontinge yo ko wunya ka kati kapi ke men pufontinga pandenge laki e ya konanti fiu ning kema kaning ya humpoti yo so afu ju koning pake pakan kening kayek yo bare idika mening kai ko kunyuga katu idika ye wa hutu hini ngai ning kai no kate tol pika pigen ka kai penga ka penga idika mi bare langka kayang kau fan yo sinyo yi pupo kai o pakan ke meaning ke meaning ko kunyo kun o kai ke ko kunyo ke meaning ngato ko ko pongie ekna ne yo kan ajuka yo ku yalla maskiala ne kila la ne ekala sempe knem non pakan pufonting ke papayenge kai ka on mas nin ka kunyo ngatei o ka mit nin kai ko kunyo tumando baro idika ini yo katifan take o katifaneti yo inki kresino memak anchu koni ninka kuma idika ini katifan ake achuwa yo ninka midlom banin kaya ko yo kaina lom katifan ko hunyu kanga kaya nko pongo achuwa so kuna nenchuke ni maskia is very important so kuna nunde ake kuwi ko kuketi okay. All right, in Plehle, I know I had a technical but hopefully he can cover some of the key points. But in check time more fiki more. So John here you catching your patawe abaraka pasugi timba
James and ilimai wali kalon plong kadim kami panokon pangkayen corona ke kunyu conference kefa mask wa many anongon anyanyango anyanyango kwaso uni ko take chahinkin anongon kadim baw fan kilimai tio long last words or something. So ladies and gentlemen, we are basically discussing today the mask, and it's in Aku Manjago and Karoninka. We've given the main things of the mask. We've talked about the fact that everybody should put on a mask, how we should put on a mask. We've advised everybody at least have about 2 masks, the cloth mask. We've also talked about the fact that, well, it's good for you to have not just a single cloth, but like, double cloths, like you see what is inside over here and what's outside, so it will be different. We say that the mask should also be very comfortable, and the presenters have said quite a lot. So we're going to go back again to Dr. Domingo Gomez, who will give his final thoughts. And as you give your final thoughts, there's always one area of concern that I have, and I think we need to emphasize that. Some of you did mention it, and that is to say, for our parents, of course, we know that the mask, we use it when we are going out. For those of us who have parents that are elderly and that are old, that have comorbid conditions, it is important that when we are at home with them, and some of you mentioned that even if we don't feel that we are sick, that during this period, during this pandemic, during this surge in the Gambia, it is advisable that when we are dealing with them at home, we put on our mask, just in case we may have corona and we may not realize that we have corona. And I just want that to be among the points, that you were going to mention as your final thoughts regarding the young ones that actually come home and obviously putting on mask. The second point, I think, is a point of emphasis, is that let us emphasize that it's because we know currently that putting on the mask, you are more protecting the other person, not more of yourself. Therefore, what we see in the Gambia, I can tell you that if you look at the Gambia effectively, test 10% of the population, basically, if not less, are the people putting on mask correctly. So let everybody ensure that if you're dealing with somebody else that is not having the mask, make sure the person puts on his mask. And from my own example, many people will have their mask in their pocket. And it's only when you tell them, put on your mask, then they search for it and put it on. But I don't think it's fair. You carrying the mask everywhere, struggling with it, it's not comfortable. Somebody sitting down there and not putting on the mask, and that person infecting you. So people should take responsibility and make sure that whosoever you are dealing with, ask them to put on their mask. And if you have your final thoughts, Kijari Banya Manjaku. Ba Manjaku is a little bit on the other side. I think Dr. John Jabang, program Corona tari undika abukin Dr. Domingo Gomez, unda chiri punya kari kamas. So Dr. Domingo, please just emphasize those points. And if you have any final thoughts that you want to have, please have them. I've been looking at the comments below. Like you know, this program is a joint program, and it's one that is also in the memoriam of the late Dr. Jones. And most of the comments and the discussions are people expressing their sentiments to the late Dr. Jones. So Dr. Domingo, your final thoughts and few comments.
Thank you again, John. Beti manjakunda barang kak mak makaka wulin numbos. An wute ti na yirundi burum ti program corona pi ti John alessa lusonde ilongeri manager wonde puata stuli forza wonde pep lincha la serenia pour banyanka mene irimi wonde jay bling tu ci wara yi ma yi wara pour ngal ko fini lom di fini man tay chumbu mene ci face mask rik wakrin kun ci bura bis na mtumbi buko ci bimme be kap ci pour karanya atte banyan kap mobul ko ma ci ko butim inyi butim yimen ka jak ci lingat nyan jat ni ci diga tol no fi ngili butim ajak ci diga tok les ka fara ko les o kal sok les iralo wuli banyan komp ban banyan ci rew leru mel legi face mask ri un ci bura bind ñakana mbing buko kap bofri ngi butim man tay may ko pembari ka tom nata bana bu fa ka ci diga to ngap les na ñi butim ko bat te mu wata sat face mask ri ko di ka fara ko wala ka miso ko be jabi be njabalon ko jabi wala na kalso na iralo utabantan wala ngal di ba metu ka tanja ka lesembar ne ti bulong par ko moj ci met ko japp mobalon ba nyang tem dik me ba mobal ko ka pi ban ninko le fu ka yekam dik cho dik ninko ka tiju ma ka tiju pul ko ngaya da par wim berat ngo ko ngel ci ngir lef ngi me jang tinku nga kamam ko moj bu ko lynch atek ka ma ko wala pul nyani me na ko taf ana kam lom mo jaka bap nora nyana man to bak bandar ka metti na kanati pol wul ko won de ja wara pa jangal ndu yend biki menda ci rikata par balom banyan ci biki me ka pu ci le par nga lempo kal nang long mi tera da kam mo da tepandi wokandar ma mak da mende wokandar mak kay da pour rat ruk nga mi tar nga banyan jang ko mi tar lolo wala mi tar nga tam di ñaka ndu wak nga face mask bling face mask mu den nan teme wala ci ni ci wi ni wuccu ka tank ko ci tema wala am ci ka ñaka nanji njine wucun ka tanka parang ko ngin chun ka chilirim tumuna yisu bleng tu ko ka pentim chiron so ko ci ka tanki wala ko mu ci ngal bi tanka kara nyank les plesalas a chintu ku jol nul bet ne tema pour nulo tene tanku pour de tank lar bleng tinda cité iri manta yondi jawon daga lincha lastul pour ba nyanka mene aka wombori mak pour ba nyanka wak nga face mask nga bof yi ñiwi bi tem kara ka chil barikata am lesu kalso am les ka miso am lesiralo klesa de face mask betemu bata temu wata sat face mask de betemu te kara nyang kap jana temaro wole won jong ka wata sar pour de lesalas yu nyakanu ndare la bara mak ma fiar tol tikan tanyantum na ba nyambi tangi ya parte bro ngandi ya para on ka chambi thanks a lot John that would
Dr. Margot, if you are on, just help us discuss those few points, and also if you have any last words that you want to share with the people, you're most welcome.
Thank you, sir. I'm right here, sir. Then young boy and then young girl, we can they come. So do ya, where will they go, where will they come? If you better say we don't kind of host, we look for self, feel fine. Do you make sure say even if not also day, make we wear a mask, especially when we day with them mommy and then pa them.
Dr. Margot, I think you would get off the video. So
Okay. Okay. Should I start again?
can you start all over?
Okay. Then young boy and then young girl. Now, I want to talk to back because now we can. Yes, sir. Then young boy and then young girl. Now, I want to talk to back because now we can come out and now we can come. So do ya? If you didn't host, you see yourself. You sabi say you but not they feel fine like I can they feel normally. Do ya? Make we wear mask, especially when we dey around with mommy and with papa them, with granny and with grandpa them. Make we always make sure say we wear mask. We sabi say we didn't host, everyone they feel well. And if person back come for relate with you, if person back come for keep company with you, or get a job for do with you, and the person not wear a mask, not forget na hand. Just remind them, suffer, make you wear a mask. So you back, are you wear the mask to protect the person have to go wearing you and they protect you. And as I may not remind on the last time, if you didn't also not feel well, you the cough, you get your chest tight, for breathe. Say then this year you not understand your body. The number where you for call 91025. And after you they call and tell you you can come. You can also self-isolate yourself. You can then one place na the host na yourself. This program here so na Coronata series we one of the Agba Dr. John Jabang na organize. Where we go to meet we company them, they talk to them now we own language them so they go understand we better. And it will come now on our way again next Friday, this same time so. So do your next Friday back on a tune. Make una support this program because now una make it organize this program here back. And we hope say this Corona series here done, this program would turn something else. We go say we go for every family them back. Till the next time we are go see we are go keep comping but una picking me na una sister Dr. Margot. Una thank you, Dr. Jaban Kusha.
Okay, Dr. Margot, thank you so much. This program will continue by God in power. And even after the corona, we could bring in so many other discussions very related to we had. Thank you so much, Dr. Margot. So, Changat, Abu Chembusini talk some final words.
Okay.
Just Kiliman Kalamanu Nukupan Kalampo. Actually, I could some of them the
right.
nang toko la machi ya group kampani pa pagin pagkatimu kami wahu.
Okay. All right, John, abaraka parti sa pilua minti ayu kachin discussing hine ya fi organize na panap memak hine yuruan memak pakanam samani fanju sa kafalu pagpulundu ko bokup unlompong kati just PHP hinam futoko ikna hilime hanusaka koning kuyoklunde kaya hiyo poisson masque egna pila jempen usok sa kempe fie pigna nula fie no one an Gambia non Gambia na pati fuluti enofi follow na yakot haji tikiton hin kata apia no enofi pi beng pa pem bengo beng pem fi usuti apo for ning ko kunyinga ke kikasinia o o yaka vaccine do o kikasinia mulu na yakut haji tikiton hin kata apo suto tenufi yo lombalom ba fulti tenufi waso masketi e mom ful matenufi la mo waso masketi na wasiayo timpilik waso yo yenu kalili ko fie pongi yo na kalompo yama pakayu ifulu ya ka pakai timarse o pekayu kakao la kena o pekai serkunda wasoyo de na fulio in fulanyo na fulana samane fanji so fa pujo ba na kiyo la ma weli iyo i pufondinge palompo nun kwati sokalu lompo i aluniem kui pagambake makaning nu soki super spreaders i ning di ya kakunyuka idini meni ni kai kakunyuka yo so number 1 nusuto pipati pa pekayu tu pudula pibang fiu nenkenge kad nini ya koko idini meni ni kai kakunyuka ni kai ni tifan ko inya ni papa o mamata alu o tifan ko take fondinge ay atalu o man aka naka tifan ko pakano i ne hin engenge samane fan sofa no soka falo ko nyinga ke ko hepon ke ko vaccine pour l'optan pe gambia pour pi ko sembe even uni petoni penu pe tibabudu ko nyinga ke kino uni kutu pour l'optan pe meni pour fora for memak bara hadi gabi ngati hinuni kutu keme ni kuru eme ani ngo hini jahal yo nunu ina jahali sokonto malu pakandwa keme kan nga gambia wamin pume jahali façon ni kaga hin najwa so ko ngati sopa ngati hilo malu ni noti suno falu timbini nafula lompo ni kati ben pisa pesa oldo me pers high five karenji fama ku engenke ni ngonol fie hani ni ufano space ya kana papaya au pae kare kasuma la mapaya ni lompo kaya for afila ni kolola na sokapi api laki so hani kare mfano kachini na ufano kachini afa hin understand yo eke yalompo I'm sure eke kuwe ni lopo Gambia bening bankai ne so ko samani na yama hemolaning awla mayem tipu waso maskia nkai no hile ki engenge ngasoki au fulen kaino kasu watani apu un pambaka ni sofiane ngenge hani eknatom kaduna inekna o mana na ni fulano feka mebina e kokunyuga da katifani so ukata ne ekna ukata na kasu watan pakambaka fiu kadu kokunyuga kaimani kokunyuga ina force na hindaka nan kaya fo chonko kihini ki sembe ngata kamukal anowan aw jonko so njibi din kokunyuga fienki ka fie sembe bare fie mollo ho hina led ko da jenni ekne fe choltogo ngati hilo mano wan pulontu ni sabari tumpunu suwan pakambaka ni anona ngawase maskia ekne mkoning awena le fit pour ko gunya kayam kato timpi yama e kako timbi kiti fanta kata ona ke hinu kan dina fala akna fango ajwa so uhinayo embrace koning kwa meni wa wedape ajwa so egnan jilla fiye hiso ni lompo I napati nyowe pesi I was pusofuna hina usually ni recommend 20 seconds but pikaba ati ni hita kuno but what we know important now was sofuna was your in mamole pesi kulondu nyowe pesi fair cool not then when in your in one single episode atuka so ekana nu hine recommend ekana nu yake soko pambaka kulondu pro chocolate ko kogunyika kineraketi so kolompo kemia ning kitekasu waran na ka kolompo tumpo so koning ninji soka koning njega kogunyinge ano ana fasu waran ifaka soko kara eke kogunyika hani ekne nyango na ka kogunyika hin call PMK ko kapi kemia ning ngati loptan pa nsoke koning jiko kunyenge kiamtinji wa hewenji yake hichoko tamaserenji yake choko kwa kapsoke pumunyange hinu tama nyakolo but now ka itoko lompo o pakani lompo kafere na inu call I hamol nombo ninki na ka kunyenge pako ngaki nga inu ka sepitoni nga wasite jungnya nga ga chobi chifita ngaso hilan now keta ni pakoti on kuyenga nga ino ko ka sisi kutoli ngiti faltei yo pako ka midni ngate ngaka ti sunufi ngaka kati fanoli o pakamba pulontu so konana nu ya kai so kuye pulontu kueti uni pina loptan po unu la mauni tuni ko hinu entai manango una pulontu Gambia pulontu dunia pulontu ufu choko la sipes pour pinia hopu hinu manango so ekna nula fie ke soko una pakana you know pour anora pusikola nu kate kadu yene ate kamionol nu ni ap pianganga dol pour ka kunyanka kate komon ngufultu dunia ye yo in jipati sokala atimpa timpa and for fanyak bakasitan and then kadu na yurwan en ken ko kunyikan komon nu ya nu nyohiati engi normal life etuna so John ki ufan yu hila mapo inji pa lo pati here you kakin yo abaraka
yeah changa that's fine abaraka timbo ya saga igna hiyam to so kalau ne kulon kame ko kunyu dam kame ni unya nyang ko isu misu ni da dike kunyu okay an kunyu nas aso dike kunyu an yor ko falanka ngingi no falanka ngita ke falanka sempeta woro amno wana ngameni apodike sitien emission ye ekna la manuka kai so no so lombo ano wani arjuma ti wati ye unin kale fu ku belon poklona ay ano won katimbo si din suma ti pudumba jen jobari soki timbo Dr. Domingo, I want to say thank you so much. Thank you. And just to remind everybody that every Friday, same time, the same place here, we will be speaking Karoninka, Manjago, and Aku. And we want to ask everybody, these productions that have been done, they have no, how do I call it? How would I say? They belong to everybody, and all the media houses and all the clubs, all the cafes. If you hear some bit in Manjago, you can download it, you can edit it. All right, you can just take what you are interested in. You can just take Manjago, send it to your to everybody, because the whole essence is just to ensure that we are able to communicate to the wider world. So that's that. Today, we had to take a little bit longer because we also took some time to give some tribute to my very senior colleague and a senior colleague to most of us, a founding father to so many things, Dr. Ulric Jones. May his soul rest in peace. And I want to take time to say thank you to Dr. Azade, who came around to give some words and some tribute regarding Dr. Ulric Jones. And I look forward to having, if not obviously a physical or whatsoever service, a memorial service that may come on. So to all the presenters, James, thank you so much. Domingo, thank you so much. And Margot, I want to say thanks to you all so much. Till we meet again. Tomorrow we are here. Jola, Sarahule, Sere. We are here tomorrow, same episode. And on Sunday, we are here, Mandinka Walla Fula, on the 3rd episode that we will announce to you later. So till then, all of you do have a wonderful day. Bye-bye.
Yeah. Bye. Okay, thanks. Okay.